Good evening, Jim.
Good evening, Seanin.
I'm delighted to welcome you to this virtual Féile discussion.
Yep.
Where are you right now, Jim?
I'm in Bahrain.
Bahrain. And I would like to introduce you. You are Professor Jim Dornan. You are a former obstetrician and gynecologist, retired, very high profile obstetrician and gynecologist with the Belfast Trust for over 25 years. You're also head of department at Queen's, and you are currently head of department for the Royal College of Surgeons in Ireland in Bahrain.
That's it.
Okay, so today you were supposed to deliver a lecture yourself, but I've been asked to interview you. It's really, the title of this is The Case for Implementing an All-Island Health Service. Yep. And I suppose really we should begin by asking, why now? Why, in the wake of the biggest health crisis over the last 6 months, a worldwide pandemic, most extraordinary challenges for the health service, why do you think there is a case now for implementing an all-island health service on the island of Ireland?
Well, I mean, you're asking an awful lot in the very first question. But I'm certainly not suggesting that we implement it tomorrow. But medicine is changing and people are changing. And we in Ireland are no different than anybody else in Europe. We want the best of health. And certainly this COVID situation has made us realize even more importantly how much health is to us all. And I just see an awful lot of advantages, not just me, a lot of us see an awful lot of advantages. The way medicine is moving, how we should, harness those changes and where required, which would be a lot, work together as one unit on this island. And you mentioned the COVID-19, and of course they say, never waste a crisis. And this is a crisis. It's a huge crisis, but it does open eyes and makes us realize how we should move forward together. I mean, quite simply, Seanin, the people of this island have so much in common, socially, ethically, genetically, aspirationally. We all want the same for our loved ones and for ourselves. And those who provide healthcare, the healthcare workers, we all work from the same textbooks. We all went to the same colleges. We all have the same names, our numbers and letters after our names. We use the same guidelines. We practice the same medicine. So I'm not for a minute suggesting that we start tomorrow. And in fact, I'm very against a political imperative to put the two together. But I'm very much for a clinical imperative to look at all the areas where the people of this island, socially and fiscally, could be better by working together.
And Jim, how would you sell that to the Unionist community who perhaps
I'm not
are fearful of going into an all-island health service, and also on the money side of things, because we have an NHS that's free at the point of delivery. We know in the Republic, you go to your GP, you pay €50 before you step over the door. You pay for your prescriptions, your meds. And,
yeah, well, certainly, I don't think that's acceptable in north of the border or south of the border. Mm-hmm. So I'm not suggesting a clean sweep. We start all changing everything tomorrow. But what I'm saying is, I think the three pillars of the health service, NHS, are generally accepted worldwide as being very important. Meeting needs of everyone, free at the point of access, and based on clinical need and not the ability to pay. So I wouldn't be suggesting changing that. But I'm not appealing to any particular group, the Unionists or Alliance Party or Nationalists or anybody else. I'm appealing to potential patients. I'm appealing to the people. And the people want value for money. And the people want excellence. And the people want what's best for them and their family. I mean, we've already in the last 5 years have a wonderful example of how the congenital heart problems are now being dealt with. And they're being dealt with in an all-Ireland scheme, so that if there's a baby got a heart problem, whether it's in Limerick or Derry or Bangor or wherever, that baby will be delivered in the right hospital at the right time. And we think as one country, and that centre is of excellence, happens to be in the Republic, but that doesn't matter. Centres can be wherever. And nobody thinks, oh, I'm not going to have my child go to that, to have its heart done. We all know that that's the place where to go. So that both services are working very well there. And there are many other examples that could work. You see, the Northern Ireland is small, and it's medicine's about volume in many ways. And there isn't enough volume in so many areas in medicine in North. And even in the Republic, in some areas there isn't enough. But together we could be a Goldilocks country, Goldilocks side, and have so many areas like plastic surgery, the management of acute strokes, emergency departments. The list goes on, where there would be benefits to having health being harmonized between the North and the South, so that the best possible treatment can be offered at the best possible price in the most efficient way.
That's an excellent example you've just quoted in the All-Ireland Congenital Network. I know there was opposition at the beginning in Belfast among some groups, but it has worked wonderfully. We featured a little girl, a 4-month-old baby, on our front page during the pandemic, baby Camille, who was from Belfast, who during the pandemic had a 6-hour life-saving heart operation.
Brilliant.
And it was just extraordinary. And there is that reciprocal arrangement in Belfast where she is looked after by consultants, and that is a great example. But I'm interested, you mentioned plastics, ED, cancer, maybe even organ donation. I'm sure even though you're in another part of the world, you're retired, but you still speak to a lot of your colleagues. When we spoke the other night, I mentioned how at the beginning of this pandemic, I had a conversation with a consultant, a very high-profile consultant, who said he would fall into line with the South tomorrow. He was very concerned at the direction of Whitehall in terms of testing, their strategy. And I asked him to go on record about this. And he said, no, there was this fear that they didn't want to speak out. What are you hearing from your colleagues?
Well, no, I mean,
would they like to get into line? And why do you think they are afraid to go on record? Is it the whole political side of things when really it should be clinician-led?
There is lots of fear around. Okay, I'm not going to argue that. But I think this is culture. It's 20 years ago, I remember meeting William McKee coming back from London on the plane up at Aldergrove. And I remember him, he said, I was at a very big meeting in London today. He said, you guys have had your day. It's the day of the manager now. He said, that'll last for another 25 years. He said, then maybe it'll come back to listening to the doctors again. And I think it is. I think that we're living in exciting times, Seanin. Do you know that medical knowledge is doubling every 77 days? That means by Christmas, we will know 4 times more about our medicine than we know now. And so it is very exciting. And management, we're going to have to listen to doctors. That's just the way all there is to it. So I think things should be clinically driven. I'm sitting here tonight talking to you because I believe that there's a huge clinical imperative to look at every way we can harmonize health on this island. It's not a political thing. That may or may not follow someday, but that's not. In fact, if you want to ruin it, turn it into a political imperative. But if you want it to happen, keep it as a clinical imperative. And that's what I think we should do. I think the congenital hearts is a wonderful example. And there are many other examples in the area of ED and areas of acute stroke management, areas of plastics, cancer surgery, anything that has low volume, that is high but high skill, where the doctors and nurses and care workers, north and south, can pool their resources and get the best out of it. I remember Mark Taylor telling me that he had been over in China, and he went to a hospital that I think did 80 Whipple operations for pancreatic cancer every week. 80.
It's extraordinary.
So just imagine if you just do things in an efficient manner, using everybody's skills to the best. That's what we're talking about, efficiency.
Efficiency, and so much here, as we know, has been driven by efficiency savings. And
so we can work together.
We have, so you mentioned the workforce, so there's problems both sides of the border. We had an historic nursing strike at the beginning of this year. There was a similar one in the Republic last year. We have huge shortages with our nursing and midwifery workforce, again, because of efficiency savings come back many years, places were cut. So in this new Ireland, where you have a new all-island health service, clinician-led, nurse-led decisions, the politicians, though, still have to play their role. Will they do, Jim?
I'm sure, but they have to waken up and listen. I mean, you're talking about workers in the health service. There's nothing more important to people nowadays. They used to say it's the economy, stupid. It's the economy, yes, very important. Health is very important. And yes, I suppose to a lot of people in Northern Ireland, apparently less than 50%, nationalism is important of where they actually live. But health is important to everybody. Now, the world is a village, and that's all there is to it. And a lot of our healthcare workers will come from all over the world. Now, we don't have a particularly wonderful history of looking after people who come from all over the world to Northern Ireland. There's a lot of racism. There's a lot of, I mean, it's incredible when you see the racism, and the next night, the same people who are being racist are being looked after by the nurses and the staff who they were being racist to the night before. It really makes me sick. So yeah, I mean, but look, we're all in this together. And if we half of the Northern Ireland budget goes in health and social services, okay? Half of it. So just get that into our heads. This isn't something we twiddle around with. I think Robin Swan is doing a very good job. I saw the memorandum of understanding that they did for the COVID. I thought that's great. And in fact, somebody's already done the work. It's a very good generic memorandum of understanding. I think you could take out the word COVID and put anything that is to the clinical and fiscal benefit of the people of this island.
Yeah,
very simply.
That's agreed. It was an outstanding document and very aspirational and had great objectives. It wanted to both sides to harmonise, to cooperate. Unfortunately, that didn't pan out over the last few months in terms of sharing of information. But
why? Why?
Well, because we followed Whitehall in terms of testing, and thankfully that has reversed, and we have hopefully coming out of lockdown, following the first wave, the idea is to have a more harmonised approach, which is just what you've been saying. But sharing that information is obviously is. It
is. But the point I was making is that the document is a good starting off point for going forward. Because COVID, to be honest with you, was a bad one to start with because it's too political. I mean, even England and Scotland can't agree, and they're meant to be in love with each other. And England and Wales, you know. I mean, there are 180 different countries in the world, and there are 360 different, methods of quarantining. I mean, it's just phenomenally hot potato politically. So let's take something nice and simple. We started with hearts, and then let's add on ED. I mean, after all, with over 300 miles of border, if you live 50 miles either side of the border, Northern, wouldn't you like to think that you would be taken to the best ED department and the border would be irrelevant to it? Wouldn't you like to think that? Absolutely. And there's no reason why that shouldn't happen. Yeah. So I think the northwest of the country and the west of the country could benefit greatly from looking at different ways that we can harmonise health. So personally, I would say that a nice simple MOU, Memorandum of Understanding, that every initiative, every clinical decision at department level has to pass the test. Have you looked at it? Is there an opportunity to harmonise that would improve clinical outcome and fiscal outcome efficiency? Simple as that. If it doesn't, fair enough, move on. But don't say it doesn't when it doesn't. So don't make it political, keep it medical.
What about ED? As you know, there has been numerous reviews for the North, going back to Morris Hayes, saying we have too many hospitals, we need to downgrade. We had a leak in the Irish News a few weeks ago about decisions taken at the highest level to close the 5 biggest EDs here, or A&Es as people call them, to walk-ins. Denmark have a similar model. How would that work on an all-island basis, do you think?
Well, I think, both, if you go back to when I started, the GPs played a huge part by looking after people during the night. And they were great triagers, dividing people up into whether they needed urgently seen or whether they needed seen at somebody's leisure. And I think we've got to not move back to those days. I don't think they're gone, but we need to move back to triaging being carried out by primary healthcare providers in urgent care centres.
Yes, which is part of the new plan. Yeah.
And look what we've got. We've got great communications. We've got great roads. Nearly everybody's got access to a car or a vehicle. So the world has changed tremendously. I can drive down to Cork in 3 hours. The fact of the matter is that we need to have our EDs full of the greatest staff we have, which we have at the moment, but not stepping over people that shouldn't be there. Simple as that. Yeah. So people who need to be in trauma centres should be in trauma centres, but the place shouldn't be littered with people who shouldn't be there. So they need sorted out. But on the other hand, the people need protected. And if somebody's sitting at night at midnight and is frightened and is worried, then they need to be unfrightened, defrightened. And quite simply, again, the COVID has changed the world. The whole way of communicating with social media and video consultations and everything, that's the way forward. That's the way it's going to be. So we need to just get our heads around it, that obviously clinicians need to be protected, that they don't make mistakes, but a very sophisticated triaging, reassurance where appropriate, advised to go to urgent care centres where they're sorted out to be seen at leisure or whether they need seen urgently. So I'm totally supportive of anything that does that. But wouldn't it be daft to have one in Altnagelvin and one in Letterkenny? Wouldn't it be daft to have one in Sligo and one in Enniskillen? You need to get these things sorted out. One in Drogheda, one in Newry. This is where huge efficiencies can be made, and we can do it for the benefit of all the people, all Ireland.
What about other areas that are similar to both mental health, for example, addiction? Two massive areas. Prior to COVID, mental health was a particular problem. North of the border, we started to hear about more suicides. We have one of the highest suicide rates.
Seanin, for those of us who weren't physically scarred by everything that went on in the last 40 years, 50 years in this country, it's great. But there's an awful lot of people who were scarred. We live in a post-conflict society, and some of the nonsense that goes on is nonsense. The Good Friday Agreement has been a great beach ball for the politicians to play with, but it hasn't delivered on the ground, and and it needs to. And it's just tragic, the amount of young people who are committing suicide, etc., and living in anguish and anxiety and depression. I think we need to. I love South Africa, and there was a great thing over there that I used to support called the Boys Clubs, and used to say it's better to build a boy than repair a man, and it's better to build a boy and build a girl than repair a man or a woman. So I think we need to get right into schools, that every class, every school should have a mental health person who can make sure that the kids are growing up with confidence in themselves, confidence in their abilities, confidence to deal with the modern world the way it is. I read recently, and I thought it was a good one, that the best gift you can give your children is confidence. Now, you don't want to give them false confidence, but at least give them so that they have worth, And we've got super young people in this country, and it's a crying shame that so many sadly decide to take their own life without us, the people, having stood in their way. So let's prepare our youth better. And please, I'm not going to mention any names in particular, but I am so fed up in this country of having people who just want to keep raking up the past. Of course, things need to be addressed, but not every morning on our radios. And I'm just, we're in a post-conflict society, and that needs to be remembered. And somebody needs to wise up.
Just to move on, we referenced earlier the culture here, and particularly in COVID, as a journalist, I really did notice how many consultants, experienced consultants, nurses, were afraid to go on record. By contrast, in the South, they were, they spoke very freely about their concerns. Many of the interviews I did certainly were off the record. Our culture here, in terms of even health service scandals, we had hypernatremia, which you're familiar with, led to the longest running public inquiry. Sir John O'Hara said he hoped that the culture had changed and that there was evidence of that. Lo and behold, then a few years later, we now have the neurology scandal and also the Muckamore Abbey hospital abuse scandal.
Yeah.
I know we've had cervical check in the South, but there does seem to be a culture here where these terrible, traumatic incidents have occurred, where there has been this culture of suppression. That Muckamore, for example, something I've worked on, relatives have fought to get answers. But what is it about
the North? I don't. What is it about the North? It's like, what is it to do about Maria? I mean, the bottom line is, when I was a young man, the North was seen as being the bastion of liberal life. You get contraception and divorced, whereas the priest-ridden South was a place that you only went to for your holidays, And 30 years later, it's right around the other way. Now we're God-fearing, God-frightened, and the Republic is maybe feeling a bit better about itself. But I don't think that's the answer to everything. There is a lot of secrecy. There's a tendency to make things secret. And I've been always impressed by the New Zealand attitude. And New Zealand have no fault compensation. Simple as that. So you do not have to prove negligence for anything to get compensation. So doctors aren't, and nurses and everybody else aren't hiding anything. They're not locking it away. It's transparent. So nobody's pointing fingers. Yes, of course, people can be found negligent, but the people who are suffering don't suffer. They don't hang about 20 years to prove that somebody did something wrong to our Jimmy. So I think I would love both health services to really think about that. New Zealand have done it. It hasn't cost them a complete fortune, and they do it very simply. And it's one of the great moves that we could do to bring transparency into the health service, is to have no fault compensation. Just look it up, Google it. It's very, very fascinating. So I do think fear, the wrath of God, and secrecy are too prevalent in our culture.
And what about also, Jim, the bureaucracy here in the North? We have a Department of Health, we have a board, we have a PHA, we have 6 health trusts, and then we have multiple quangos. There have been calls for this bureaucracy to be reduced. If we were to move to this new era of an all-island health service, where do you start with that? You talk about efficiencies and saving money for the health for the good of the people, but when you have so many layers of bureaucracy, it's extraordinary. And numerous reviews of saying this.
Yeah, no, I know. I mean, I felt before I came here a few months ago, I felt that there was a general acceptance that people were now going to, at last, accept the various reports that suggest this does need to be addressed. I'm not an expert on everything by any means, and you do have to have good management. I tell you, one of the biggest problems, we've got some wonderful managers coming through now. I mean that in the health service, who have been trained to be managers, who are managers. Unfortunately, throughout the health services, North and South, England, Scotland, Wales, because of this change to the management side or on the clinic side, there's an awful lot of people running around well, I think they run around with iPads now, not clipboards. But, you know, and they've been elevated above their station, to be honest. They were in some other job, and then somebody gave them an iPad. So we've got some great managers, some great ones. And we've got some great managers being trained to be managers, which is great. But we've got some people who are just stuck in there. And too many of them, to be honest. I'm not going to quote names, but people should do the job they're trained for. That would go a long way, I promise you, to addressing a lot of the problems in the health service.
So coming out of COVID, we are preparing for a second wave, and we basically have two systems in one, you know, going back to ED, or A&E, where you're streamlining one set of patients, and then you're almost two doors. Same for all aspects of the health service, but particularly A&Es. So how do you think services will work as we prepare for this second wave? And, you know, in this all-island health service, as we prepare, you know, you mentioned the Memorandum of Understanding. Hopefully that can be built on. We have an all-island mobile COVID app, mobile phone app. Yep. Which is great that's due to launch. It's a world first. We were briefed on it last week, a group of journalists. How would you like to see things that can't happen overnight, especially when we don't have a vaccine? But you've quoted so many examples there with congenital heart network.
As I said, just to recap a little bit, but I mean, I do think that quite simply there needs to be a political will, and then the politicians need to stand back. So the two chief medical officers, just as they did for COVID, should look together and say, listen, we made a good go of the congenital hearts. Let's come to an understanding that everything that is introduced in either our health services, we look at it and it passes two tests. Is there a clinical benefit, and is there a fiscal and efficiency benefit to us harmonizing those services? And they have to answer that for everything that's introduced. That's not much to ask for. Mm-hmm. And, you know, I mean, to be honest with you, I think in sport, soccer is the only one where we don't play all Ireland. Isn't that right? Mm-hmm. But, you know, economies, agriculture, tourism, so many areas we are already working together, you know. Mm-hmm. I belong to the Institute of, and the Royal College of Surgeons Ireland, and the Institute of Obstetrics and Gynecology. All the medics, we all belong to the same colleges. And the people in the Republic, the doctors, they belong to the colleges in London as well. You know, we're all in the same boat here. That doesn't mean that necessarily we're going to vote one way or the other. So let's depoliticize the whole thing. It's all about what's the best healthcare you can get at the best price for the country to afford. It's as simple as that. And all it needs is a blue touch paper of political will to start it. And after that, sit back and let the medics and the nurses and the healthcare providers and the managers work it out from there onwards.
I suppose just finally, we have a situation here in the north. Yes, we have the NHS supposed to be free at the point of delivery, but we do know there's people waiting 5 years on hip ops. We do know that pensioners are going to the credit union and borrowing £4,000 going to Lithuania, getting cut price hip ops, some of whom are coming home and ending up in ICUs. So even though it is supposed to be free, it's very much, we have a two-tier system here where you pay your £150 to see a consultant privately and you will get bumped up the waiting list. I think
that's a big thing you're saying there, and I think that's a dangerous thing to say. I did hear of that 20, 30 years ago, but I hope that's not happening now.
Well, we have spoken to people who say that, you know, I paid to see someone privately and they were able to do my surgery more quickly and I won't have to wait the 5 years. They might have to wait 6 months.
If that was happening, that people were going to have a private appointment to get bumped up a waiting list, then that should be heavily investigated. But I don't believe it's happening, to be honest. I think there's a misrepresentation. So I'm not going to let anybody down there or anything. That shouldn't be happening. Okay? Simple as that. But I'm going to be honest with you. There isn't a country in the world that doesn't have a multi-tiered system of health. And honestly, Charlene, it's as simple as this. It's down to money. At this moment in time, most European countries spend about 12% of the gross national product on GDP, sorry, gross domestic product on health. Britain spends about 9.8%. The Republic of Ireland spends about 7.2%. So it's as simple as that. So it's as simple as the people vote in the people, if you want, who promise to spend more on health. There's no magic button to it or magic bullet to it. It's as simple as that. Now, where we have a problem is that, and actually the two services, interestingly, are both going in slightly different directions, and they're passing each other on the motorway. Because you have, in the Republic of Ireland, has about 50% of people are in insurance, and 50% aren't. And so they've always had this private-public partnership, which they're sort of thinking of trying to get away from. And the NHS has always been hypocritically, we're against private practice, even though the ones who make the rules all go privately. Mm-hmm. So both are moving in their own direction, if you like, because they should be meeting in the middle. The fact of the matter is that the recent COVID has been very well managed, both north, south, east, and west, by the teams that have been looking after them, but by both services working together. In the Republic of Ireland and in the north of Ireland, they've been working hand in glove with the private sectors, and it would be hypocritical if they, at the end of all this, they said bye-bye, cheerio, because that's the way health is. That's the way it is in every country in the world. Mm-hmm. And people don't always want to hear it, but that's it. You get the health you pay for. Mm-hmm. And that means and who you vote for.
Mm-hmm. Oh, absolutely. But in this new all-island health service, obviously, as you're a medic, first and foremost, you would not want to see poverty being a barrier to that pensioner getting the hip up and living 5 years. And yes, that two-tier system is probably going to stay with us. But you just referenced COVID and how the private sector and the public sector, we know here the private hospitals come in, they go give over their hospitals, their theatres, their staff, and you would hope that COVID has shown that this can be done if the will is there.
I agree with you.
I suppose finally, even though we have had, tragically, we've had more than 2,000 people have lost their lives. We know how devastating this has been for the care home sector and very vulnerable elderly residents. But do you think there have benefits have come out of the pandemic in showing us how we can work? And it is in terms of the future and an all-island health strategy, it can perhaps pave the way for a better health service.
Yeah, so in many ways you're answering your own question and answering it very well. But the fact of the matter is that yes, the COVID has been a disaster medically and for so many people, but it has accelerated an awful lot of change. So we'll never go back to everybody filling the GP surgeries, everybody filling the ED departments, waiting to see somebody face to face. That's over and done with. So the whole new way of consulting, whole new way of being triaging, that's going to happen over this whole COVID thing. The fact that the two sectors have worked so closely together, it would be the height of hypocrisy if after this they stop working together. It's interesting. I'm really not sure if I should say it, but I'll draw attention to myself. I'm sitting here at my age, and the health service was very good to me. I loved it. It was great, but also gave me a very good pension. So nobody told me that I had to, have a private pension. I'm sitting here today, still getting paid for a hysterectomy I did 40 years ago. Okay. Mm-hmm. Now, if the governments, either government, pay the private sector for doing that same hysterectomy, that's it. Okay? So they're not sitting 20 years later still paying the doctor for the hysterectomy. So there's a lot of benefits of working well with the health service, with the private sector. Both sectors need to work together. At the end of the day, if we find an oil well in the Glens of Antrim, everybody can have everything they want forever. But if this country gets a second wave and maybe a third wave, or we move into some other plague next year, we could be living in very difficult times. So there isn't an endless bucket of money to pay for health. That's just a fact. But I do hope that we move more and more towards real politics, north and south, rather than where you stand on the border. I hope we move to real politics that will look at health and economics and everything else, so that people will vote for the politicians who say, we'll fund that, we won't fund that, we'll fund that, we'll do this, we'll tax that, we won't tax that. That's the way forward. We've got to grow up as a country.
I know I said that was the final question, but just because you keep referencing politics and clinicians making decisions, have you ever considered going into politics yourself? And what about, there was an outcry over the lack of Unionist. I know you don't define yourself as a Unionist, but there was no representation in the Seanin. Sinn Féin were amongst the first to criticise that. Could you see yourself as Senator Jim Dornan?
No, definitely not. I think they missed a huge opportunity. I love politics. Northern Ireland politics oppose me. I think I think there's so many good people in all the parties, and I've met a lot of them, and they really are good people. And then I think, what would they be like if they weren't tied down to what happened 100 years ago? And I think how wonderful they would be. And I just think it's so sad, because someday, whatever happens at the border is going to be sorted out. And the next day, what are they going to stand for then? I want to know what they're going to stand for then. That's real politics. So
that's a no. That's a no. You're not.
Well, of course, no. I want to be president or nothing.
Professor,
I do.
President Jim Dornan. Well, Professor Jim Dornan, it has been a pleasure. Thank you very, very much. And that was my first virtual Féile, so it's been a pleasure. Thank you.
Thank you very much. Thank you.